whenever we have a big cold snap like this, the most common type of weather-related injury, accident, crash, whatever, is the fall. It's the simple same height walking fall. Unfortunately, as we get older, we get less spry on our feet, and so when we fall, we can actually take some pretty serious hits. Elderly in the world of trauma and falls is actually 55 years old. And when you fall, you can break your pelvis, you can have internal injuries, you can break some ribs and have bleeding in your lungs, or the worst case scenario is if you hit your head when you fall. Skull fractures, brain bleeds, we see them quite a bit actually. If you do happen to fall, the last thing you want to do is just jump right up. You just want to kind of stay there for just a second, wiggle your fingers, wiggle your toes, make sure you didn't break anything. The number of people that we have that fall and break an ankle and then jump up and try to walk on it is actually pretty amazing. A lot of people do that and then they hurt their extremity worse, which takes longer for healing. Now, if you do fall and you do hit your head, if you're knocked out, you really need to seek medical attention and get evaluated. If you're on blood thinners of any type and you hit your head, even a mild bump and you're not knocked out, you're not confused, nausea and vomiting, nothing like that, you really need to get checked out also. Those blood thinners really affect people hours afterwards, and a debilitating or deadly brain bleed can occur. So since falls are so deadly, sometimes it kind of helps to practice to be on slippery surfaces before you actually have to go out for real or to prepare for it. In the marketplace now are types of cleats that just slip onto your shoes. They got little studs on them. These are like four-wheel drive for when you're walking. They really make a significant difference, and many of them with just these little studs you can actually drive your car in still. We even recommend it for people who are at risk, so the elderly or on blood thinner, to get these even if they're just going to the mailbox and back, because they make such a great difference. Now, if you do happen to feel yourself falling, don't use your arms to try to catch yourself forward or backwards. You want to kind of curl up into a little bit of a ball and just kind of take it on your bum or your side. People hit their heads, it's a bad deal. The other thing you can do to prevent falls is we call it kind of the shuffle walk, where you kind of shuffle your feet along. You're not really picking them up, but you just kind of shuffle and keep your feet on the ground at all times. And you can also grab a walking stick, either a commercial hiking type sticks or just a simple stick will help you keep your balance. We really take this pretty seriously in the hospital, especially elderly, 55 and older, and especially people who are on blood thinners, because it is so serious.